Good afternoon. I am Els Van Caelenberg, the head nurse at the day surgery unit at the University Hospital of Ghent, and I would like to present a study I did in collaboration with Professor Benoit, Professor Verhagen, and Professor Mark Coppens, unanticipated admission after ambulatory surgery in the pediatric population. We found in a study from WIPI that the incidence of unanticipated admission in the pediatric population ranges from 1.6 to 2.2%. The primary aim of our study was to determine the incidence of unplanned admission in the University Hospital of Ghent. We also want to identify the factors associated with unanticipated admission. Our data was retrospectively collected between January 2016 and December 2018. Patients aged between 1 month and 17 years, pre-booked without an inpatient bed, were included. The exclusion criteria were patients over 17 years of age and all the procedures performed outside the operating room. Successful day cases were defined as those discharged at the same calendar day as they arrived in the hospital. Finally, 4,235 cases were analyzed, of which 78 children required an unplanned admission. 61 children were planned admissions, but these children were not included in the statistical analysis. Here you see the reasons for unplanned admissions classified according to 4 subtypes: anesthetic, medical, surgical, and social organizational reasons. The most frequent group was anesthetic with 37.3%. Of the anesthetic reasons, post-operative nausea and vomiting and inadequate pain control were the most reported. Of the surgical reasons, bleeding after urological procedures was the main cause of admission. Cardiorespiratory monitoring accounted for 13% unplanned admission in the group of medical reasons. That was due to airway or breathing problems, in particular in children undergoing ear, nose, throat procedures. Adenotonsillectomy in patients with sleep-disordered breathing and without other comorbidity is safe in children over the age of 4 years. However, we see that these children are experiencing unplanned admissions. Delayed start of the surgery accounted for 10.2% in the group of social organizational reasons. This table shows the results of multivariable backward logistic regression for predictive factors. As you see, children younger than 2 years, ASA class 2 and 3, length of surgery more than 2 hours, time of completion of surgery in the afternoon, and surgery that took place at the other side of the campus are significant factors associated with unplanned admissions. Our conclusions are that it is important to avoiding children with significant comorbidities, the necessity of careful selection, avoiding complex and long duration procedures, prioritizing children, and the pre-operative anesthesia consultation as gatekeeper for safe practice. The correct patient selection for day case surgery and identification of high-risk procedures are essential because failure to discharge at the same day has a negative impact on patient and family experience, service provision, and hospital financials. Especially now in full COVID pandemic, it is very important that the capacity of the hospital is not unnecessarily affected by unplanned admission. So, our study shows an unplanned admission rate from pediatric day case procedures of 1.9% in the University Hospital of Ghent. With risk factors age under the 2 years, ASA class 2 and 3, length of surgery more than 2 hours, time of completion surgery in the afternoon, and surgery that takes place at the other side of the campus. Thank you very much.